Hey everybody, it's Erica B from Beyond the Bump, and I actually am twisted up in my seatbelt, coming to you guys to kind of give an update on postpartum, my postpartum journey a year later. Still twisted. That's okay. If you know my story, then you know that I had a hypertensive, high risk pregnancy that ended. Next week will be a year ago. Well, it didn't end there, but my baby was born a year ago, August 17th. So I wanted to kind of do an update because, number one, I'm having a lot of feelings that have to do with that baby right now. I'm still dealing with a lot of postpartum issues, and I really wanted to be just very upfront about them because you guys might be dealing with them too. So, had my baby in August. I ended up in hypertensive crisis. 6 days postpartum, I ended up back admitted in the hospital for 4 days with the IV magnesium. I ended up on 4 different blood pressure. Was it 4? No. This time it wasn't 4. The first time it was 4. I ended up on a total of 1,600 milligrams of labetalol a day, and 60 milligrams of procardia, or nifedipine, extended release twice a day, which is a lot of medicine. So I'm happy to report that probably within the first, I'd say 4 months postpartum, I was able to get back off of the labetalol because I wasn't on anything but hydrochlorothiazide when I'm not pregnant. I'm still on hydrochlorothiazide. Like, that's one of them things I'm probably going to be doing forever and ever. So with that being said, I'm back down to my regular medication. So within a year, I have since had quite a few transitions with my job, with my location. I've moved states. So picked up a family of 4 and moved states, and so that is, in itself, is a lot. We did that in May of 2021, so May of this year. Everything's been going really well, and I'm mentally feeling much better. Shout out to my Tulsa work fam. I love you guys, and I know you know that. But I feel a lot better where I am right now, and so if you're in the Texas area, hit me up. Other things that I've been dealing with since having my son, my second son. Skin issues, like new skin issues. I don't know if this is like I'm having a baby in my 30s and this is different than having a baby in my 20s, but I've been like really sensitive skin wise. I had my tubes taken out so that I can have no more babies because I like to be a little too adventurous with the blood pressures on those. So there will be no more of those. So sorry. But I'm actually pretty happy about it still. I had that done in October, so we waited about 7 to 8 weeks postpartum to have a salpingectomy. So the whole tube was taken out. I still have my ovaries. I still have my uterus for now. I'm still on the fence about whether I eventually want to have a radical hysterectomy, take it all out. And that's because my mom in her early 40s was diagnosed with ovarian cancer. And so I might want to just get it all out. Just don't need it. Less organs, less tissue to have a cancer cell in. So my doctor advised me that if I wanted to do that, because I didn't have any glaring issues with my body, the taking of the tubes was actually a very good way to decrease my risk for ovarian cancer. And so that was a great start. He said that if we did everything right now when I was 31, that would increase the risk of other things like heart disease and type 2 diabetes and things like that. I don't want all that. I ain't got time. So we just did the tubes, and I've been very happy. I think it's helped calm a lot of the anxieties that I have surrounding my prenatal and pregnancy and postpartum, like PTSD, because I know it cannot happen again. That procedure was really not painful or kind of very uneventful. It was a same-day surgery. So if you have more questions about that, you're thinking about getting sterilized and you want more information, feel free to message me, comment below, ask questions. Dealing with body weight issues, I feel like I haven't lost very much weight this time. And I'm really giving myself a lot of grace because, we're in a pandemic. I have two small children, and I determined I can't do everything. I started going to therapy or seeing a therapist. We had to do it via Zoom so far. And she has really helped me to prioritize a lot of things that I wasn't prioritizing, including me. So that's been going really well. And I have learned that, tomorrow's a new day. There's only 24 hours in each one. So mommies, daddies, family members, everybody, just give yourself some grace. And know that if you're doing the best you can, that might not look the same every day. Doing the best I can some days is, hey, you took a shower. Doing the best I can is, hey, you didn't have a major emotional meltdown. And some days the major emotional meltdown is the best I can do. So, shout out to everybody with the major emotional meltdowns like myself. So this morning, which led me to this post, I went to a dermatologist, and what led me to that was I went to a hairstylist, and I'm thinking, I was on all this blood pressure medicine. My hair's been really thin. Since I had my first kid, my hair's been really thin. I've always attributed that to all of the blood pressure medicine I had to be on. I'm just figuring, circulation can't be that great, and so that's what it's got to be. So my hairstylist, when we moved here, was like, girl, you got some bruising on your scalp. Now, mind you, I had just been at a wedding, so I had a braid style done, the month before, 3 weeks before that. So I'm sitting here girl, I'm just tender-headed. My scalp is sensitive. I have these braids, and my scalp just hasn't recovered, or I'm not taking care of my scalp. I need to be moisturizing it more. It's hot, that kind of stuff. And she said, I think you need to go see a dermatologist. So whether she knew what I'm about to tell y'all or not, I would imagine she probably knew something. Being a nurse and knowing how to pose questions, which are really statements. I already know this is going on, but you don't know yet, so you need to go find out for yourself. She wanted me to see a dermatologist. So being in a large city, it takes a long time to get appointments with people. And so it took me probably a good 6-ish, maybe not that long, maybe 4 weeks to get an appointment with a dermatologist, where I found out that I have this CCCA, and it's actually a type of alopecia. And that really stung a little bit. Not because I didn't think it was the case. I really kind of thought it was the case because of how thin it's been, and because I know that could have been it. I know that one of the main things it could have been was alopecia. The reason that my hair was so thin and that my edges were gone and that kind of stuff, I attributed it to baby, kind of. I attributed it more to blood pressure meds because it didn't come back very much between kids. And so my kids are 4.5 years apart. I would think it would have come back a little bit. So when it didn't come back, I'm sitting here thinking, okay, cool, I'm going to get in shape. I'm going to lose all this weight again, because I lost 70 pounds on my first keto journey between 2017 and 2019. So I'm thinking, I just need to get back working out, eating right. It'll be fine. She's like, listen, we have to do all of these different medications, all of these topicals, all of these oral meds, these supplements, to try and get your hair to grow more and to try and stop it from being worse and thinning more and from you being more bald, basically. So I have this big spot in my crown that I'll show you guys here. I have a big spot in my crown that I'm super self-conscious of. And so if you know me and you've seen me, I really try to hide that spot, a lot. It's bad enough I can't hide edges very well, but I really do try to hide that spot a lot. So that was today, that I found that out. And so I really wanted to just share that while while it was raw, because I'm not the only one. Apparently this type of alopecia, and I will butcher this, but it was like centrifugal, I can't even say the other C, I'll post it, alopecia. It's basically where the crown is what's losing the hair, and it appears only, pretty much, like the statistics say, it mostly appears only in black women between ages 30 and 55. Isn't that wild? Like, man, I'm 32. I mean, it's been happening since before that, but could you pinpoint me a little bit more, you know? So I'm really dealing with that. Of course, I have, you know, lots of support. My mom actually has pretty much the same thing. And they say, well, she, the dermatologist, not they, say that it is related sometimes to like having braids and having sew-ins and having, you know, these things that cause tension in the heads of black women, because we like to get our hair did in specific ways that require attention. But I'm tender-headed, so I'm not doing all that. And so she said, well, then in that case, it's probably hereditary. And so I knew that my mom had chemo. Her hair, she had chemo in 2007, 2008. Her hair did not grow back quickly at all. Like, when I say it took a decade to be like, oh girl, there's some fuzz, she's got some fuzz right now. Like, she got a little more than fuzz on the sides, but on the top, it's like, it's not a lot. So I was really kind of like shocked, but not shocked. It was like all the things I needed to hear just to say, girl, you knew this. So I'm going to try my best to do what she's saying can help. And that's a lot of things. I mean, it's a lot of supplementation and topical things twice a day, and do this 3 times a day, and that kind of stuff. And she said, you know, I want to see you in 3 months, and you might not even notice a difference by then. I might notice a difference because I'm on the outside looking in, and because I know what I'm looking for, but you might not by then. So that's how slowly this process is going to run. And it's really just trying to stop loss. It's trying to stop hair loss. She's like, no chemicals, no color, like no permanent colors, no relaxers, which I stopped getting relaxers in 2012 because my roommate after college said that she saw a bald spot. That was the reason I stopped getting relaxers in 2012. So it's been 10 years almost, and nothing has really changed. It's gotten worse, actually. So basically, I'm not allowed to do anything fun with my hair, and I still might lose it. Great. So sorry to get a little bit emotional about that, but you know, as women, we are emotional about our hair. Like, it's just one of them things that's like, this doesn't define me, but a little bit I'm not the happiest about this. It's just one of those, one more thing kind of to deal with, and it's one of those things that nobody tells you about. And like I said, I can't even attribute it to, hey, you had a baby, hey, you're postpartum. But I know that the shedding cycle of having a baby, where your growth actually pauses, you don't shed as much during pregnancy, and then after you have the baby, about 4 or 5 months later, you shed all of this hair that you would have shed anyways over pretty much a year. And so it looks like a lot. Well, of course, if you don't grow hair quickly, it looked like a lot more for me because it wasn't going to grow back quickly enough for me to notice it. So part of it is the postpartum journey. I had a lot more hair, I feel like, and I used to think my hair was thick, and it probably was thicker. It was thicker. So I wanted to say that I used to wear these bows, and everybody used to love me in these bows. And when I tell you that part of my, I don't know if it was like postpartum depression with my first son, my 5-year-old, was the fact that people would come up to me after my hair fell out, or after my hair had started thinning, my curl pattern changed, everything changed, and they'd be like, oh my gosh, I just really miss you wearing your bows. And it would make me so pissed off because I knew why I couldn't wear them. My hair was thick enough to where it looked really cute. It was just like a little bow, or sometimes a huge bow. It was the cutest thing, y'all. I'm cute still, but so a lot of my coworkers would be like, oh, I just really miss the bows. And the reason for everybody who wants to know why I stopped wearing bows is because my hair got so thin that it did not look the same. It didn't have the fullness. It didn't have the volume. This is my hair now. This is not like I've done something to it. So if you look at these pictures that I'm posting about that, where you see this fro, I can't do that anymore. I can't make that. That does not happen for me. So I can't go put a bow on there. I'll look dumb. So I took all of the bows and I threw them out. All the bows are gone, with the exception of one that my patient gave me, my former patient gave me, where she had done her son's room in Avengers, and I think somebody made the bedding, and she made bows for me. Her family member made bows for me, and one of them was Avengers in the style of her son's bedroom, her newborn's bedroom, and I still have that one. I just want you to know. So guys, I'm clearly headed to work. I just wanted to reach out and just be like, hey, I haven't forgotten about my Beyond the Bump clique. I have a lot of pregnant friends right now. Congratulations to all of you lovely ladies and families on your new additions. I cringe when I see pregnant people not at my job. I do. I really do have PTSD. So I'm dealing with that. And my goal here is just to really make you feel like, A, you're not alone. I'm not gonna cry. A, you're not alone, and B, the feelings that are negative towards pregnancy. Maybe you struggle getting pregnant. Maybe you've had several losses and you're pregnant with a rainbow baby, or you're praying for your rainbow baby. And I am praying with you. If for those of you ladies who have experienced loss and have hope for tomorrow, keep that hope. When you are pregnant, it is absolutely okay to hate every day of it. And I'm saying that for somebody who knows who they are. It's absolutely okay to hate every moment of being pregnant. It doesn't mean you love your kid less. It doesn't mean that your kid will come out knowing, oh my gosh, I hate you. You don't hate your kid. I hated being pregnant. I hated pretty much all of it. Mostly for mental anxiety reasons of things that I know from being a labor and delivery nurse that I can't unknow, and things that I've seen that I can't unsee, and having coworkers that told me, I'm so glad that I had my kids before I was a labor and delivery nurse. And that just, it does something to you. And so, from losing 25 pounds in my first pregnancy, to the readmissions, to the cardiac issues, to the chronic hypertension, to just not liking it. It is absolutely okay to wake up and be like, I'm so glad my baby's okay and healthy, and I really hate being pregnant. And those two statements they don't have to be mutually exclusive. So for anybody out there struggling with I'm not happy to be pregnant, for anybody out there struggling with perinatal anxiety, perinatal depression, just not understanding why you're not happy when everybody else is running to touch your belly, running to ask you a million questions about what you've registered for, when maybe you're terrified of registering, like I was. You're terrified to tell people you're pregnant, like I was. Because tomorrow things can change. And that's what's real. I just want you to know that I'm here for you. I want you guys to know that. And I want you to know that even though we struggle and our bodies transform and they do these amazing things, you don't have to love it all. And that's okay. And me with this new diagnosis that seems kind of trivial to me, but I'm allowing myself to feel it. I don't have to love that either. And I don't have to love that my pregnancies probably expedited this or played a role in it. So, I said all that to say, this is me being just completely candid. I'm Erica B from Beyond the Bump. And feel free to leave your comments, your stories. But please like, share, and subscribe to my channel. And I will be back with more Beyond the Bump posts, pregnancy posts, postpartum posts, keto posts, all those things. If you have any specific topics you'd love for me to touch on, please feel free to reach out. I love getting your feedback, and I will see you guys later.